So welcome back to the channel. So let's talk about thyroid today. So when we see the histology of thyroid, right, we see a structure like this, and they have specific names. So let's do that. This is called colloid, and this is called follicle. Now here is that normal follicle's shape is cuboidal. Now when it's more active, that means they has to increase their size. So this is columnar, and when they are less active they have to decrease their size, and this becomes squamous. It's an easy trick to remember. Now what we will do is we will take the cross section of this follicles and colloid and we will zoom it out. So let's do it. Okay, let's assume that this is colloid, this is the follicle part. Let's write this is colloid and this is the follicle. We shall draw the blood circulation also. This is the blood circulation, blood vessels. Now in blood vessels, what is there? Okay, so there is sodium iodide and potassium. Now remember, it's not iodine, it's the reduced form of iodine which is called iodide. Now this sodium and iodide enters the follicle with the help of a pump. This pump is known as NAI symport. Now what happens? This iodide will go further in the follicle, but the sodium will enter the blood vessel again, right? It will go back to the blood vessel, but there should be something in exchange of sodium to go back to blood vessel. So for that we have potassium entering at the same time in the follicle when the sodium is exiting the follicle. Okay, now let's see about what's present in the follicle. This is endoplasmic reticulum. It produces Tg. What is Tg? It is thyroglobulin, and it is under the vesicle. Let's say it is vesicle. This vesicle is due to Golgi tendon, sorry, Golgi body, right? This is due to Golgi body. Okay, now here what happens is this iodide will enter the colloid from the follicle. So here iodide, but there should be something in exchange of iodide to enter colloid. So there is chloride ion from the colloid enters the follicle when the iodide is exiting the follicle. So we shall name this pump also. This is called as chloride iodide antiport. We have discussed it in membrane transport, so please check out that video also. Now what happens? This iodide in the colloid has to convert to iodine, which is the oxidized form, and this is called as peroxidase, right? Now see, this thyroglobulin enters the colloid and iodine enters the colloid. Thy- Thyroglobulin has tyrosine molecule. So let's make that something happens here, right? Okay, see. This is iodine. Let's call it T, and this is T. When one iodine combines with a tyrosine molecule, it is called MIT or monoiodothyronine. When iodine molecule combines with tyrosine, it is diiodotyrosine. One means mono, di means two. Now from here what happens? See, okay. So when mono and di combines, mono plus di means 1 plus 2. That means 3. T3 is formed. When di and di combines, it is 4. That means T4 is formed. Right? Imagine again. This is this is the extension of colloid. Now this okay. Now T3 and T4 enter the follicular part. This is follicle, and this process occurs due to pinocyte. See here, pinocytosis occurs. Now there is release of T3 and T4 with the help of presence of thiol endopeptidase. It's thiol endopeptidase. Now T3 and T4 will enter the systemic circulation. But in systemic circulation, let's say here, they are bind to proteins. Let's say this is one protein, this is second protein, this is third protein. In both there is T3, T4, T3, T4 and T3 and T4. These proteins can be globulin, which is maximum. It can be albumin, or it can be transthyrein. Transthyrein. Okay. And now this T3 and T4 enters the receptor. So remember, the thyroid receptor are present inside the nucleus. This can be an important MCQ you need to remember. Okay, so we have seen the physiology of thyroid, but it's important for us to see the difference between T3 and T4. So let's see T3 and T4. Now T3 is more potent. It is more active, fast action, and T4, it is more in number in colloid and circulation, but at the same time it is less active, less potent, and slow action. So what happens due to more potency and more activeness? T4 has to convert to T3. Okay, this occurs due to 5-deiodinase. So this basic physiology is important to remember. Now let's see the pharmacology of it. It's really very simple and easy. Let's go it with a trick. So in hyperthyroidism, there is increased thyroid in the body. So our aim is to decrease the thyroid, and for that we need to give some drug. So the drug class acting on the sodium iodide symport, so they are thiocyanate and perchlorate, but these are not used nowadays because these are more toxic. Now the other class of drug acts on this peroxidase. They will block the peroxidase and thus forming of T3 and T4. So this can be propylthiouracil and it can be carbimazole. Now this carbimazole, it has some teratogenic effect. So what happens? It's contraindicated in first trimester, and it can be given in second and third trimester due to its teratogenic effect. Now, the third class of drug acts on this thioenopeptidase. So what happens? It will block release of T3 and T4. So there are mainly two drugs used. It is potassium iodide and there is Lugol's iodine. Now, what is the other way to inhibit the T4 and T3 release? So there is a drug class which inhibits 5-deiodinase, and the examples are it can be used steroids, beta blockers, amiodarone is also used. So it will inhibit the conversion of T4 to T3. Thus it will decrease the thyroid in the body. So that's it. Thank you. If you like the video, please subscribe the channel and hit the like button. Thank you.